Hello, everyone. Welcome to another webinar from the Steps Forward Innovation Academy. Today, we'll be discussing Plan, Do, Study, Act approach to improve quality, work-life balance, and equity in your practice. The PDSA toolkit has been renewed and is available for all without any registration or membership, totally open access. Before we begin, we want to remind you that this session will be recorded and will be available after the event. You can use the audience link you joined with today for replay or view later. When we will publish this on the AMA YouTube channel. You can download today's slides as well as a lot of wonderful free additional resources when we reference the additional resources widget on your console, which I think you'll see. Following today's presentation, Dr. Hall and I will be able to address any of your questions. So as they pop up, put them in the chat. Submit them using the text box on your console, and we'll get to as many as we can. Without further ado, let's go ahead and get started with today's webinar. My name is Marie Brown. I am the Director of Practice Redesign here at the AMA. I have practiced internal medicine for over 30 years here in Chicago in 3 different settings: at an FQHC, at a 2-person practice, and at a large integrated health center. All of these PDSA tools and examples we'll use can be applied in each of those settings. I'll be speaking later on many of our resources offered from Steps Forward, but starting off our discussion on PDSA, I'd like to introduce my dear friend and colleague, Dr. Laura Lee Hall. Dr. Hall is the President Emeritus, Center for Sustainable Health Quality and Equity at the National Minority Quality Forum. She's the author of our PDSA toolkit, and I had the opportunity to work with her and learn from her at the American College of Physicians. We're thrilled to have her here to discuss the PDSA cycle and how to apply it with you. Welcome, Dr. Hall. I'll hand our audience over to you.
Thank you so much, Marie. And I just want to say what an honor it has been to work with you over these number of years. I've certainly learned a lot from you. And I want to thank everybody who's listening in your busy schedule. It just confirms what I know to be true, having worked with thousands of physicians and their staff in hundreds of clinic locations. What a dedicated group of people you are to help promote health. So let's just jump into PDSA. Here's the name of the Steps Forward module, and it's really meant to be very practical. As you heard, I'm with the National Minority Quality Forum. I actually founded the Center for Sustainable Healthcare Quality and Equity, and am now the President Emeritus. Before coming to NMQF, I had the great fortune of heading up the Center for Quality at the American College of Physicians. So let's see what PDSA means. I guess the first question all of us want to know is, how's this going to help me, right? So PDSA, Plan, Do, Study, Act, is a rapid cycle quality improvement method. And it can be applied to a wide variety of projects from the clinical location all the way up to the system. It's relevant, as Marie mentioned, to clinical teams, to practice settings, and large health systems. As Marie noted, and I can attest to, it can be applied in small 1 or 2 physician clinics, large academic centers, residency programs, large practices, FQHCs, and free and charitable clinics. I really have had the great fortune of working with clinicians in all of these settings, and I know that it can lead to improvements that you want to realize. And it can be tied to value-based care incentives, as well as your professional requirements, such as MOC. And it really can be used to promote health equity, which I think all of us know is an important issue and an ongoing need. So here are the steps. Plan, develop the initiative. Do, implement your plan. Study, analyze the results, and act, make adjustments, or proceed with what happened. PDSA, you see, it's a circle. It's meant to be an iterative activity so that you take tiny steps, small bites at improvement, and you see if it worked or not, and you continue until you reach your goal. Indeed, it's something, once you know how to do it, you can apply in so many ways. So what's your plan? You got to think about what you want to have as your outcome and how you think what modifications can help you reach it. And then how can we determine that we actually improve? Sometimes we forget to look at that. I think all of us have heard of the quintuple aim, and it can be used, or the PDSA cycle can be used to achieve any of these aims, from enhancing your patient's experience, to improving your population health, to reducing costs, to improving the work life of your team members. I know that's really important now in this day and age of great stress to many clinical teams. And as I've noted, it can help you achieve better health equity in your practice. So you are going to get these slides, and you'll see that much of the attention of our conversation is going to focus on developing your plan, because you really do need a precise, rather simple, important, well thought out plan. Define your goal, get the information you need to understand that, set priorities and timelines, pull together your team. You'll see I'm going to say something about the team. Develop the detailed action plan. Make sure you're aligned with anything going on in your system or your practice. Set SMART goals, and we'll talk about that. Communicate. I almost feel like I want to make PDSA have a C at the end of it, because communication, I believe, is really important for effective engagement. Okay, things could go wrong. You can try to anticipate that and mitigate challenges, refining your plan. And oh yeah, we need to get approvals and resources, right, to do anything. So where are your gaps? How do you set your goal? I think that you look at quality metrics that are prioritized in your practice. That's something I've worked with a lot of practices. They know what they're being asked to improve. So that can be a very important way to set a goal. Look at your quality metric reports. You can do a practice assessment survey. You'll see we have a link later on to a sample practice assessment survey that I developed, and we used at ACP as well as at our Center for Sustainable Healthcare Quality and Equity, or SHC. Really helps you think about your strengths, your patient populations, the barriers you may face, etc. Root cause analyses. So the 5 whys in the fishbone diagram, we're not going to go into that, but there are resources for how to implement it. And I will tell you a secret, maybe not so big a secret. Make sure you include the folks who are involved in the care issue that you're working on, because they may see things that you as a physician are not as aware of in terms of the workflow and day-to-day operations. You can actually survey your patients to see what their views are in terms of gaps, or what their incentives are. I once worked with a great practice in New York City and Queens, and they at a FQHC surveyed their patients about barriers to getting a vaccine. And they were very interested in, was it a cost thing? Was it a knowledge thing? Was it a fear thing? And they learned it wasn't a cost thing at all. It was really, they didn't understand that the flu in this instance was a serious illness. So it can help you pinpoint kind of the root cause, if you will, of an issue that you may want to work on. Your staff may be able to provide some input with the survey as well. So these are just ways in which you can understand what your gaps are and what's contributing to them. This is a very busy slide, and what I'm going to refer to, and you'll see it at the end, is our quality improvement drive toolkits at NMQF SHC. So all of these resources are free and downloadable, and they're inside the AMA Steps Forward module as well. This may sound didactic at this point, but PDSAs are really a very practical way to improve your practice in whatever way you want to focus it on. I think this is very important, this fourth bullet here. Start small and be very specific about timelines, your goal, the role of individuals involved. Starting small is important because it'd be nice to have a victory if you're just introducing your staff to PDSAs and quality improvement. And specificity means you're going to get it done. If you don't have a specific plan, there's a huge risk that you really won't implement it very well. Okay, here's the C again, communication. Who needs to know about this? Well, your boss needs to know about it, right? Executive leadership, if you're in a big practice, because you may need some resources for them. You may need, for example, IT to run a report for you on a particular performance measure. So you need your leadership to know about it and buy into it. You need your staff to buy into it because, they can and will ultimately contribute to the success of any improvement. And why not let them be a part of the positive improvement, which I think will actually improve their whole vocational buy-in and happiness with their work. And okay, maybe you can't think of a specific QI project to do. We actually have a whole library in a variety of clinical topics, and the AMA Steps Forward has a lot of samples as well. So you're not on your own here. Oh, don't we all want to be at the beach now, huh? Keep it simple. You can't really boil the ocean to realize, significant improvement. You have to take it step by step and build engagement and commitment and positive results step by step. So I know you guys are really smart. I should say guys and girls, but what does it mean to have a SMART plan? Okay, I'm kind of beating you over the head with be specific. So who's going to do, what are you going to do, where are you going to do it, how are you going to do it? Make sure it's measurable. I think all of us have good intentions and we make changes, but how do we really know if it worked or if it's something we can expand upon? You got to measure it either through an EHR report or something as simple as tracking with a little piece of paper how many times something is done in a given day. Make sure it's realistic. So this is kind of related to going to the beach, right, and keeping it simple. You don't want to try to achieve something that there are so many variables contributing to it that it's just not feasible. Make sure it's relevant. I mean, you and your team and your leadership and even your patients, you need to know this is something worthwhile, right? And timely. So there's a urgency, and time is also related to being specific. So this is how to translate your natural smarts into a good quality improvement project. So this is, I think, my last slide related to planning, and that is having your QI team, which I've been calling champions. And what is a QI champion? Well, you need somebody at the system level, at the leadership level, in various departments who believe in what you're doing so they could lend support in the way that only they can, with data, with resources, etc. You really need to have a champion at your practice level. And you can see here, that can include everyone from a physician, should include a physician. That's the leader in a practice, or perhaps an advanced practice clinician. But it's not just a physician. A nurse, practice manager, patient navigator, pharmacist, really anyone in the practice who is relevant to what you're trying to achieve. And I wrote here resident. I've worked with several residency programs, and inevitably there's one or two residents who are really going to be passionate about doing QI or working on improvement in a given area. And they can be amazing in terms of getting a project done. And oh, by the way, don't they have to do a QI project? So it's a team of leaders who will implement the program. So they're basically going to come up with the idea with input, of course, develop the plan, again with input, and they're going to implement it and communicate the effort. I have been surveying our clinicians over the last 12 years on what makes for the best QI outcome. And invariably, a passionate champion is considered one of the most important ingredients to success. So here's implementation. You've got a detailed plan. You know who's doing what. You've made sure everybody knows their role, and you've gotten the buy-in of everyone who's important. So don't think just because you did all that pre-work that you shouldn't be keeping in touch with folks. You should be in touch with your team that you're working on this with. You should keep your practice apprised of what's going on, using team staff meetings to provide updates, for example, using the bulletin board in a lunchroom to provide updates. This is an important component of engagement and helping to ensure your success. And because we're human beings, okay, even you physicians, I'm a neuroscientist, we are all motivated by stories as well. So being able to share a positive experience during your activity can have a powerful impact. I can tell you that two examples. One is where really the person who was at the front desk was so inspired and passionate about the project they were working on that they almost single-handedly led to the success. And so sharing that and calling out their enthusiasm and leadership was extremely gratifying both to this person and the whole staff to see that it's someone on the team is making a difference. I know that in another instance where we were working with practices at Duke University, and they had identified, did a PSA test for a number of Black men just as COVID was hitting. And the results of that kind of languished for that, we remember that horrible year or so. And so patient navigators went back and they resumed the project with the PDSA, where the patient navigators actually reached out to the men who had a troubling result. And they were able to identify 2 cancers, actually, that led to positive treatment. And sharing that story, I think, really helped motivate the whole staff involved. Stay agile and make necessary adjustments. Everything doesn't work out the way you have it worked out in your head. Just be ready and use your smarts and your team smart to figure out a way to keep it going, to adjust it in a way that will help make sense. Okay, analyze your results. I'm not going to go into a lot of details here. We have a sample chart, an Excel spreadsheet, where you can actually look at the changes over time. Don't be fooled. It's important to understand if you're having an impact. You may think you are, but it's not really working out that way. Plus, showing in a chart, for example, that you're having an impact can be a positive feedback to your team and to the leadership. This is a little bit repetitive in that you're putting your plan into action. I will tell you that in almost every QI project I've done, every PDSA, there was some educational activity for the staff and or the physicians, usually during a staff meeting or at a breakfast or a lunch, to really keep them up to date on what's going on and why, providing some of the scientific background for why it's important and why a particular approach may be helpful to adapt. This is another C, although it's putting the plan into action. Again, chart it out so you can actually see the effect. And you see the effect and you think, oh my God, this worked great. I'm going to expand this. Or you see the effect and you think, got to make a little bit of a switch here. It's not quite reaching what we want. Or heck, it just didn't work. I got to go back to the drawing board. I'm going to call out a great practice in FQHC in Richmond, Virginia, led by Dr. Good, where they, again, this is during the COVID pandemic, that first year before there was a vaccine or known treatment. This FQHC is 2 brick and mortar sites, and they also provide services to homeless people. And even though they were greatly stressed during that period of time, they implemented a couple of PDSAs and realized a 42% increase in flu vaccination, which, you know, is pretty amazing for that population at that time. And this is an equity PDSA, by the way, because the vast majority of the patients that they served were either African American or Hispanic. I'm just showing you this, that you could make a big impact. So more on, okay, I've acted, I've implemented my plan, I'll adopt it, I'll adapt it, or I'll abandon it. It doesn't mean you're abandoning trying to improve things. It's just that you want to actually improve things. Okay, so see, I'm CCC, communicate, celebrate, continue. Keep everyone apprised. Celebrate the work. Acknowledge the people who really contributed. Let your boss know. Let the leadership know. Let your patients know. You could let your whole community know that you are working to improve care for them. Get the word out and continue in your journey to be a champion for healthcare quality and equity. So this is an actual table of activities that had been implemented and especially relate to health equity. We all know that social determinants of health can really interfere with optimal care and outcomes. And this is especially important to people of color, to underserved communities, to rural communities, et cetera. And so goals that could be included in PDSA related to addressing social determinants of health are simply documenting the factors that patients are facing. I can't tell you how many times a good first step is documenting the issue that you want to pay attention to. Ultimately, you want to increase referral to community services. So a couple of example goals. So why the gap? I'll give you the example from a group we worked with in Grady in Atlanta. There may be spotty or even no documentation of social determinants of health needs in the medical record. Staff may not really even understand what they are or how to put it into the medical record. And there may be no understanding of what resources are available or how to make a referral process. This is a project that we did in Grady for over 4 to 6 months. And the QI team ended up being a physician and her nurse assistant. There were, of course, the need to have the physician lead and the IT individual and EHR vendor involved in the planning. But it was this physician and her nurse that implemented this program. And so the goal was to simply document the SDOH needs of each patient and put it in the record. They also, as part of this process, kind of educated the whole team about how to do that in their medical record. They went on to actually identify community services and referral methodologies after their initial PDSA. So let's see what happened. So we actually submitted an abstract for a poster presentation at the ADA about this activity. And this physician and her nurse were able to get 90% of the patients over a 4-week period of time to have their SDOH needs documented in the record. They did notice, because they were tracking the data, that the week that the nursing assistant was out, that the numbers went down a little bit. So something to pay attention to. They did, as I noted, go on to train all the staff about how to enter this information into the EHR. And when I was last working with them, they were working with the university and the Grady system to identify resources and referral supports. So it was a great success. Okay, this is data, just because I'm like you, a nerd. I love data. And I'm just showing you here, I'm not going to read it, you're going to get the slides, that there is a widening gap that has persisted for many, many years in terms of flu vaccine coverage among non-white adults in the United States. And we see that also in people living in rural areas. We see that in younger adults and people who are poor. This is a gap important to close. Will have a real positive outcome for many, many people. And by the way, I'm kind of getting off PDSA a little bit here, but you make the most difference. And this is true for people of color as well. The physician's recommendation is huge. And there are, tried and true and evidence-based methods for actually making that recommendation. And that can be your PDSA, really training your clinicians, your staff on how to be effective in making a strong recommendation. And you'll see when you get this slide set, there's a number of ways you can go about doing that training and then measuring its impact. You can start out by looking at the flu vaccine rates among your patients by race and ethnicity, or you can do it by chronic disease, which is also a very important risk factor. So I kind of jumped the gun here. So look at your rates among your patients of colors, patients of chronic conditions. That's a PDSA. And that's something you can share with your practice. Something that's we've been focusing on quite a bit is engaging with the community. There are many trusted voices in communities of color that can be your ally. You can provide education to church congregations, for examples. You can bring community-based vaccinations to their location, which will help people be able to access the vaccine. Simply accessing and providing patient ed resources, another PDSA, can have a huge impact. I'm not going to share all the examples here, but I can tell you that these are strategies that have made a big impact in practices and communities. And just educating yourself and your staff about the common concerns among people of color. It will help you be a better listener and a better vaccinator. So here are resources you will find in the slides that you will have access to and on the AMA Steps Forward site. And I guess I just want to turn it over to my wonderful colleague, Dr. Brown, to take it over. Here you go, Marie.
All right, camera. I think we're good to go. Thank you so much, Dr. Hall, and your experience and your enthusiasm and your encouragement really shines through. But the problem is, and for those on the call, and what I experienced was, how do you find the time? How we all know we have great ideas to improve equity, to improve vaccine rates, to improve outcomes, but how do we find the time when, with the workforce shortage, things are worse than ever? So one of the things at the AMA that we're working on, and our strategy number one, is removing obstacles that interfere with patient care. So if we focus a PDSA cycle on saving time, you're probably going to get more engagement. So I would encourage you to not add to everyone's work because the experience that you are having as you quality improvement specialists back at your organization, maybe something like this, right? You have a great idea. You know it will ultimately save time and improve outcomes, but the physicians and the nurses and the teams are so exhausted that they can't even look at you to hear what you have to say. So introducing this concept of making a change that will save time will promote engagement, because saving time is going to ultimately improve equity and patient satisfaction and outcomes, and will decrease burnout, because we know that if a physician is overwhelmed and taking 2 hours of work home and the whole team feels like they're running late and the patients are angry, then everybody feels burned out at the end of the day. And we know that physicians who are satisfied and teams that are satisfied deliver greater care. So what might this look like? Let me just share that one of the toolkits that, again, is open access is getting rid of stupid stuff. This is Dr. Ashton from Hawaii, wrote about this in the New England Journal and was kind enough to author this. Again, totally open access. And I encourage you to look at looking at something that could make more great days. Instead of saying what's wrong with the practice, what's right about the practice. Listen to them. Is a great day when everybody starts on time, when the first patient's there? Well, then how do we make that happen every day? So I'm going to show you some examples. This would be a typical patient that I would have, and probably my most healthy patient that I might see in a day. But as you can see, she has numerous problems, numerous medications, and I've had no pre-visit planning. I don't have a team approach. I do my best. I try to meet the metrics. I refill the meds that she thinks she needs. But what happens between this visit and her next visit? Because she's going to call for all the things that I ordered that day, all of these 16, 17 contacts are going to occur. And that adds up time. It's a call here, a reaction to an inbox when her TSH comes back, her A1C comes back, then it's trying to reach her, and it can add up to an hour between visits for every single patient. That could be 4 hours per patient. And that's just not sustainable. So to do this work, we need to think like an efficiency expert. But doctors and nurses are trained to think of the exception. That's why every headache that comes in is a subarachnoid hemorrhage until we take a history and physical and prove otherwise. Every sore throat is strep and could lead to rheumatic fever, or until we take a history and physical and prove otherwise. So honor your clinicians. We say, we know you're trained for 12 years to train to think of the exception. But when we present a PDSA, a change in workflow, think about why it would work, not why it won't work. It'll save you time at the end, and think more like an efficiency expert. We have tools to help you do this. Again, free and open access. And as you can see, the first thing to do is stop doing unnecessary work. That's a perfect PDSA cycle. We have a de-implementation checklist, list of about 20 things you can stop doing that add no value, often over-interpreting the regulations. And here's some examples in the PDSA toolkit of the ideas that you might find helpful. But let the team decide what they want to work on. You have to get that with them. And how do you decide what the team wants to do? You'll have many ideas. If you do the gross, you'll find things that people want to get rid of. Well, a simple 2x2 would be helpful, like this. And as you can see, it divides into 3 categories, and then have your team sort them. The upper right is easy and high impact. Bottom left is it can't be changed. But the important thing, as you heard from Dr. Hall, is ask the team, what's in it for me? Every member of that team has to be able to answer what's in it for me. Are they going to get out on time? Are the patients going to be happier and not yell at me? Are we going to get our outcomes and maybe reach a financial bonus? So sort them once you have some ideas. And we can say lower the A1C. Well, that's like boiling the ocean, right? How about doing a standing order for diabetes education? How about a standing order for flu vaccine? So think about things that you can do that are simple and high impact and can be done in the next 2 weeks. You can also receive maintenance of certification credit for it. And one of these, a PDSA cycle, can be done in as quick a period of time as 7 days. So stop doing all the things on the left so we can do more of the things on the right and get that buy-in from the team who's going to actually do the work. What does it look like if you try this? Here are some of the things that need to be done, but they can't be all done suddenly. You can't change the workflow immediately. So choose one of the ideas on the right. Just one, do a simple PDSA cycle, keep it simple, and then celebrate success and move on. With Practice Redesign, the patient's experience is completely different. She had pre-visit planning. You have everything you need to take care of her. She automatically was sent to physical therapy and diabetes education. She automatically received her vaccines. There's no calls between this visit and next. You've saved an hour, 4 hours a day per patient. And the next visit runs very smoothly and she's getting to goal. You've saved her from a stroke and you've saved her from a lot of chronic pain as well, probably. So no calls between this and that, and you feel as happy as she does. And this doesn't have to be in an Excel spreadsheet. It can be simple with a piece of paper and a marker, and have different members of the team connect who is doing the recording the PDSA cycle. It can be a small group. It could be 5 or 10 patients. It could be all the patients on Monday morning. It doesn't have to be all of the patients all at one time. So I'll end here. And the most important thing is to start small and pick a project that will be successful and then celebrate. It doesn't cost anything to celebrate. Write a note to every team member's manager. Write a note to the Diabetes Association, to the local Cancer Society if you improved screening, and get it highlighted in your organizational newspaper as well. With all of these ideas that Steps Forward 70 Toolkits has, you can save what we think is wasted right now, 3 to 5 hours a day. So you double your workforce without increasing your cost. Both qualify for MOC, and I'll stop there so that we can move right on to Q&A. Remembering that the principal driver of physician satisfaction, and really what most of us nurses and APs were called to do, is to deliver great quality care. We just need to get rid of the unnecessary tasks that often interfere with that. We'll go to Q&A, and I will highlight that we do have, to go deeper in depth, a few slots still open at the AMA in Chicago, a Saving Time boot camp, where we'll go deep into debunking regulatory myths, getting rid of stupid stuff, how to do it, and how to communicate it to our colleagues. So I will open it up for chat, and I see we already have one from let's see, I saw it. Somebody asked about how's PDSA different from DMAC. DMAC is an acronym for Define, Measure, Analyze, Improve, and Control. Pretty similar to PDSA. And any other questions? I'll try to see these if I can. And if we need to go over, if there's a lot of questions, 12:45, Dr. Hall might be able to stay on. I certainly will. Dr. Hall, any questions that you see in the chat?
Well, I see one question that I think is interesting about top tips to break down barriers when there's lack of key team member engagement. And this certainly happens in many different ways. I did a program once, and it was promoting flu vaccination, and there was one staff member who was really an anti-vaxxer, and it was very hard to engage her around it. And she wasn't a leader in the practice, but she was probably of the view that many other had some inkling of, because they came from the community. And really, it's kind of a step-by-step process. So honest engagement, we did a couple of breakfast presentations that permitted a lot of questions with an outside expert and inside expert. Having breakfast in and of itself was an engagement approach. So, more and more of the team were coming around to really understanding the importance of it. Leadership, being committed to something, is very important. Don't underestimate that. So if the boss says, we're doing this is important, then, that message gets through. And I think keeping people in the loop means that someone won't undermine a project because they weren't really informed about what was going on. Make sure people know what's going on, the leadership's behind it, generate enthusiasm among as many people as you can. And I have not seen that fail. I don't know, Marie, if you have.
Yeah, I think taking that individual approach is so key, and celebrating success. So for instance, if your PDSA is going to be on pap smears, chances are you're going to find a patient who turns out to have caught, your team catches a 30-year-old, 35-year-old woman who we caught cervical cancer early and saved her life. Highlight that story. Call her out. Here's a 35-year-old woman who we caught the cervical cancer early, and then tie that back to HPV vaccine, right? Because everybody on the team knows that 35-year-old woman probably, and her 3 adorable children. So tell the story. I think that really motivates so many of us. And ask your team, especially with vaccines, ask the MAs in your program, what do you hear are reasons that people don't want a vaccine? They may not be comfortable telling you how they feel, but they'll say, oh, in my community, this is what I hear. And then don't forget how we learn now, how we like to learn, YouTube videos. We were doing a PDSA trying to increase our Tdap, tetanus, diphtheria, and pertussis. Well, one video of showing a child struggling to breathe because they have whooping cough is powerful. And that takes 30 seconds to find it, right? And then highlight, and then sometimes people start with a Tdap because once every 10 years or so. So flu is very challenging, but if you can't get your Tdaps done, which has impact on children as well, and you can see, your rates go up over the course of a year and build year after year. So telling the story is fantastic.
And I'm going to kind of swing into this next question about focus on disparities and kind of overlap with what we're talking about, Marie. Nobody likes to feel like they're responsible for disparities. Or maybe people don't, they don't believe the data. I can't tell you how many programs I've started where they're like, oh, we can't trust this flu data. People get it elsewhere. The measurement that's in the IT report is faulty, blah, blah, blah. If you show people the data on any disparities that might exist in your practice, that's kind of hard to say, oh, these don't exist. But also, if there are questions about data for a particular performance measure, I mean, really have a conversation about that. Bring in the QI director and the IT guy and talk through how that measure is estimated. You know, it might be able to be improved by that conversation, and it will help people, I think, come to appreciate the need and the metrics involved in a quality improvement activity. I'll give you another example about how do you kind of work on disparities. I worked with an academic medical center, inner city practice, faculty practice, and a residency practice to promote, I can't remember if it was diabetes or flu vaccination in this instance, but one of the things they did was we made an introduction to them to a Black church in town. And they were invited by the pastor, who's part of our Faith Health Alliance, to come down and give a presentation to the congregation about the importance. I think this was on vaccines. This led to such an amazing partnership that then over the next 6 weeks, the academic center actually sent folks down there to give flu shots at the church. So getting out into the community and connecting to trusted leaders can really, really make a difference in terms of your ability to be persuasive, to understand the needs of the community, and to help meet those needs.
And here's a question. Can you share other examples of small steps in the do stage? How small can it be? Great question. I say this when you're first starting, the smaller, the better. You want to be sure that you can accomplish this in a very short period of time so that you can celebrate success. And a kind letter that says, thank you for participating. When Dr. Hall and I were at ACP, we gave out quality champion certificates, right? You can print them up off the internet. And I was always amazed that an MA would have it framed and on their desk. That means so much to someone that they helped save lives. So something very, very simple. It can be so small. Say you want to implement pre-visit planning, but one part of it that we're going to do, we're going to look ahead to see if someone had Pneumovax vaccine or Tdap, for example. Are you going to do it for every single patient, every single doctor? Well, let's just do it on Tuesday. Monday's always busy. Maybe we'll pick a day of the week that's less busy. And where we're going to find the time to look on Tuesday for the patients on Wednesday, and then identify who is due for whatever vaccine or health maintenance, or colon cancer screening. But are you going to do all the doctors, all the patients? Maybe you're just going to do the first 3 patients for each doctor each day. And maybe you'll find 1 out of the 3 needs whatever you're deciding to choose, and only choose one. Maybe it's pap smears. Maybe it's colonoscopy, colon cancer screening. Maybe it's Tdap. Maybe it's flu. Pick one, and then have a plan in place to identify the need. Not that you're actually going to give the vaccine, but the first thing is just identify who is due for whatever you're deciding to measure. Who is due for a Tdap? Then think about, and that you'll find that doing that over a couple of weeks, you'll learn a lot about how difficult that was to do, how sustainable it was. I think you heard that if you're not there that day, is it going to happen? You know, you want to do something that is going to make it so the whole team will embrace, and it'll happen even when you're on vacation or when you're off. And then you have to answer, what's in it for me? Why would the MA take the time to do that? Why would the MA encourage the patient to talk to the doctor if they're hesitant? Isn't it easier to just check off patient declined? But does that really get to where we want to be? So we need to understand what motivates them. And if the whole team stays on time, on schedule, and they all have time to take a break at lunch and maybe leave on time, job well done, and they can pick up their kids and not get penalized at daycare for coming late, that may be what is going to motivate them, as well as that altruistic feedback of saving lives.
I would say
Any other
a couple
questions
other
you see?
little tips that I've seen. So, for one, something as simple as putting signage up in your practice can make a huge difference. Ask me this, or, you know, common myths about the flu vaccine. That doesn't take much effort, and I have seen it make a difference actually in places. Um, what else I've seen work is little friendly competition. So, say you have a couple different, 3 or 4 different teams in your practice, physician, nurse, groups of providers who work as a unit. I mean, you can kind of have a little competition. Whoever achieves the best goals gets an award. I mean, maybe it's just a printed out framed item. Maybe one place I saw, they actually gave them coats, like a sports jacket kind of thing, like for a football game or something. A little friendly competition kind of unplugs a little bit of the incentivizing for folks. And another thing that I think can be rewarding and help motivate, and I think it's especially relevant in residency programs, the resident champion or champions, if they can get a poster at a professional society based on their work, that goes on their resume and helps them in their career path. So that's an incentive, and they will be grateful for it. So, and that can even work in the free and charitable clinics, where you often have volunteer staff and you have patients getting free care. A lot of the times we have folks from the academic setting who come in and do programs there or bring their residents in. And again, kind of linking it into some kind of project that they can write up and get some professional acknowledgement for can be incentivizing.
And we have quite a few examples in many other toolkits. So we have several real simple examples to start in our SDOH Steps Forward toolkit. One is to suggest that instead of, again, boiling the ocean and screening for absolutely every single social determinant of health, which is obviously the goal, pick one. Maybe it's food insecurity. So screening is one thing, but what are you going to do with the screen once you have when it comes out positive, right? That's another PDSA cycle.
And you can link
Dr.
up
Hall
to
said,
a church who has a food bank that delivers on Thursdays. I mean, so if you have a community connection, there's an easy way to kind of identify a resource for your patient who may have food insecurity.
Right. And you may not even know, and this is mentioned in the SDOH toolkit, call 211 or 311, depending on your city, and you will be connected to community resources for food insecurity, housing insecurity, and so forth. The other thing that just to add on Dr. Hall's, keep it simple. One pediatric group put up a sign at their entrance that said, "We are a pro-vaccine practice." So it sets the tone very early on. And often somebody is just entering that practice because they have a sick child and they want or they need something right now. But once they walk through their door, it's a subtle way of saying, we believe in vaccines. We know it's other than clean water, it has the greatest impact on the health of the population of this planet. And the other one is that people have used is, and I used this during COVID, I got some badges that said, I got my COVID vaccine, right? So if your PDSA cycle is going to be, I got my flu or my HPV, put the, I'm looking for my badge here, put that on your jacket. And you're just saying something without having to say it. Because you say, I got my COVID vaccine because I care about you. I got my flu vaccine because I don't want to give it to you. And that can be, you saw that in the Post-its that I showed on the slides. There were several examples there. But getting rid of unnecessary tasks, there's a lot of things in the Taming the EHR playbook that are very helpful to save the doctor and the team time. because asking them to do one more thing right now, think of that cartoon, is challenging. They're so overwhelmed. So doing a PDSA cycle that takes something off their desk and saves them time will build trust with those team members. And once they see that, oh, this was a good idea and it saved me time, next time you come along with maybe changing workflow or adding a little work, they're going to trust you more and say, okay, that worked last time. What else have you got?
Yeah.
So think about your first PDSA cycles. If you're challenged with engagement, as most of us are around the country, take something off their desk, take some overinterpreted rule off their desk, do a PDSA, recognize that they saved 30 minutes a day per physician, an hour a day per nurse, add that up, multiply that by 256 or whatever work days per year. How many months does that turn into as a 0.2 FTE? But turn it into what time is saved across the year and across and the cost of saving that amount of time. But we are almost at the top of the hour. Is there anything else you'd like to say, Dr. Hall, as we close out?
I want to say thank you to all of you who do such important work for the health of people in our country. And don't hesitate to reach out if you want to join one of our programs or you have further questions. I'm glad to engage with you.
Yes, and I'd like to thank you. If those of you who are going to be listening to this recorded, hopefully you're on an exercise bicycle or having lunch. Share it with your groups. Use some of the other resources. They will save you time and improve the quality of our interaction with our patients and our teams. So thank you all for attending. I know you're so busy. We really appreciate it. And check out our both at SHC, the National Minority Quality Forum, and Steps Forward, all free and open access. So thank you again, and hopefully we'll see you on the next webinar, which I think I'm supposed to mention here is, there's a survey widget on your console. Please take the time to answer the questions there. Your responses will help guide our upcoming programming. And you can register now for our next webinar from the Innovation Academy by following the link on your console. Thanks for joining us, and we hope to see you again soon. Take care now. Bye-bye.